Hi there, my name is Melissa Bodola. I formerly went by Melissa Douglas. I am married and currently have no children. I am what you would call a Weber State lifer. I have received all of my degrees through Weber State University and hopefully will continue to do so. I actually applied to the Doctor of Nursing Practice program at Weber State University last year as well, so you could say that I'm pretty dedicated. The beginning of my college career was pretty flawed. I really didn't have any motivation at the time to go to school and ended up failing my first semester of college. With this being said, I decided to take a year off to make sure that if and when I went back, I didn't make the same mistakes. During that time, I worked at a long-term care facility as a CNA. It was very demanding, both physically and mentally, but what ultimately led me to pursue a degree in nursing. I know a lot of students probably wouldn't highlight their failures on a graduate application. These failures are what has molded me into the person I am, and I'm proud of that. I have worked really hard to get to where I am, and now that I'm here, I don't want to stop. I achieved my Associates of Nursing in the spring of 2017, where I have worked as a registered nurse in the intensive care unit at McCady Hospital ever since. It will be 3 years this upcoming May. I have also received my Bachelor's of Science in Nursing in the spring of 2018 while working full time. I work in a general ICU, so we get a broad population base of patients. One day you can come in and have a patient in septic shock requiring CRRT, to the next having a patient undergoing cardiogenic shock needing a balloon pump. So you never really know what you're going to get, but these variables have really expanded my knowledge base and challenged my critical thinking skills, which I am very thankful for. I have also accomplished a few certifications. I have my CCRN, my trauma care and resuscitation, and I also have certifications in end of life care as well. These have aided me in providing the best care possible in the setting that I'm in. I have also obtained a few leadership roles. I am the unit wound care leader, so I collaborate with the hospital wound care team to treat and prevent acute and chronic wounds that may happen. This is especially important in the ICU as a lot of our patients are made bed rest due to their conditions. I am also a part of the Practice Council. I really love being a part of this committee because I enjoy implementing evidence-based care into clinical practice and being able to educate my colleagues on the most recent studies to provide safe and quality care to our patients. I am also what we call the neuro drain champ of the unit. So I am educated and training our staff on everything involved in stroke, EVD, and bolt care and procedural information. So that's really fun and it keeps me up to date. These experiences and attributes that I've acquired so far, along with my strong will and dedication, really highlight my ability to succeed in the Weber State DNP program. I have had amazing and great mentors that have guided and shaped me into the student and nurse that I am today, but it's ultimately the patients that I've had the privilege to take care of every day that have influenced my career thus far. I just want to be the best version of myself that I can be, and I want this to project into my work and to my patients. And if I'm not the best version of myself, how can I expect to be a good clinician and expect my patients to get the best care possible? These are the thoughts that consume me every day, either if it's doing patient care or not, that have motivated me into becoming a family nurse practitioner and ultimately earning a terminal degree. To add to this, I have witnessed my husband's family struggle with healthcare in regards to cultural and language barriers that has also really fueled my desire to achieve a higher education. Earning a DNP degree as compared to the master's would allow me to have a broader focus of improving care at a much larger level. I would be able to apply evidence-based care into clinical practice. I would obtain higher leadership skills and have a greater understanding of health policy, including legislative advocacy and much more. Admission into the post BSN to DNP program at Weber State, I will be able to achieve both my personal and professional goals by using these attributes that I've mentioned so far while obtaining the highest level of education in nursing to serve and provide better health outcomes to the community at large, which is what I'm very passionate about doing. I just wanted to take a moment to thank the DNP Admission Board for reviewing my application and watching this video. I really hope to learn from you guys, to meet and learn from you guys soon, and I just appreciate the opportunity to apply. So thank you so much.